Hi there, and welcome to another week of Anatomy at SI. My name is still Jayton Cranmore. It doesn't change from week to week, and we do have our cameraman back. Jacob is back in the house. So, with that, we're ready to get started with section 1 of Lab 4, the Appendicular Skeleton. All right, so let's dive in. So for Lab 1, section 1, we've got the humerus. And with the humerus, the first thing that you always want to do is try to orient yourself. So we got the humerus right here. You're going to take your humerus and you're going to look for the head of the humerus, right? That's the head of the humerus. The head of the humerus is going to kind of pop into the body or kind of articulate with the glenoid cavity up in our trunk, right? This is going to be where our shoulder connection is. So my head of the humerus would point in this way, and on our model back here, it points in that way, into the trunk, right? So for this bone, our head of the humerus is pointing this way, medially, right? So now we know medially is that way, laterally is this way. Cool. So now that we're all oriented, we've got the head of the humerus, which is right here. The head always orients towards the body. Next is the greater tubercle. The greater tubercle is going to be lateral, so it's on this side, right? We've got lateral tubercle right here, and it's on the greater, it's not called the lateral tubercle, it's called the greater tubercle, but it sits laterally, right? So we've got the head right here, and the greater tubercle, which sits laterally. And next, we've got the lesser tubercle is going to sit anteriorly. That's this guy right up here. So we've got the greater tubercle on the side, laterally, and the anterior one, which is going to be the lesser tubercle. In between them is the intertubicular sulcus. Intertubicular, it splits the two tubercles, right? Next, we've got the anatomical neck. The anatomical neck is going to sit just beneath the head of the humerus. It's kind of this line that you see going along the model, right? See that line? All right, that's going to be the anatomical neck. The surgical neck is just beneath that, right? The surgical neck is going to be right here. It's this thin region that kind of goes beneath the entire head apparatus. And it's called the surgical neck because whenever we break our humerus, it's not normally up here, right? It's normally at this thin region. And so hospitals call it the surgical neck just so it's a little bit faster than trying to find this nondescriptive thin space on the humerus. So the surgical space, or the surgical neck is going to be this thin space just beneath the head. All right. Next, we've got the deltoid tuberosity. And note, these next couple structures are a little bit difficult to see on the model, so make sure you're asking extra questions about them in lab. So we've got the greater tubercle up here, which we talked about, and just beneath that, about halfway down the bone, you see these little bony structures, this kind of rough structure, about halfway down the humerus, is called the deltoid tuberosity, and it sits just beneath or more distal from the greater tubercle, sitting down about halfway on the bone. It's this rough structure. All right, next we've got the radial groove. The radial groove is going to be even more distal or just beneath that deltoid tuberosity. It's this groove that we've got right here, right? And this groove wraps halfway around the bone. It's the radial groove. It's the smooth groove that wraps about halfway around the bone. Right there, right? Next, we've got the capitulum. The capitulum is going to be down here at the very end of our humerus, right? So if we've got the head up here, now we're at the other end of our humerus. And the capitulum is going to articulate with the radius. The radius articulates with the capitulum down here at the end of the humerus, right? Here's the capitulum. Capitate actually means head. Like if you were to decapitate somebody, you're removing their head, right? So capitate is going to be head, and it articulates with the head of the radius. That'll help us a little bit later. But for right now, let's go ahead and move on to the next structure. The next structure is going to be the trochlea. So if we've got the capitulum right here, next we've got the trochlea. The trochlea is going to be this kind of smooth articulating structure right here, and it articulates with the olecranon process of the ulna, which we'll also get to when we get to the next bone here. But for the time being, we're going to flip the bone around. So now we're on the posterior side of our humerus, right? We've still got the head up here, but now it's pointing this way. We're looking at the posterior side. The posterior side is going to have the olecranon fossa. That's this deep region on the posterior side of our humerus. All right, going back over to the anterior side and flipping my lab manual. We've got the coronoid fossa. The coronoid fossa is back on the anterior side, and if we follow the trochlea up into its little pocket right up here, it's kind of the pocket of the trochlea. It's called the coronoid fossa. The front fossa is the coronoid fossa. It's this fossa right up here on the front of the humerus. Next, we've got the medial epicondyle. So for this is the important part where orienting yourself medially and laterally is very important on the humerus, right? If your lab TA points to one of these epicondyles, you want to be able to know which one is which way. So follow your head, right? The head points this way, so we know this is medial. If we follow medial down to the other end, we see our medial epicondyle is on the same side as our head of the humerus. Medial epicondyle. Conversely, if we've got a medial epicondyle over here, what's going to be over here? The epicondyle, right? We've got the lateral epicondyle on this side, the medial epicondyle on this side. The medial one tracks with the head of the humerus, and the lateral epicondyle is going to track with the greater tuberosity up top. Okay, hopefully that doesn't confuse too much. Watch through this video. Make sure that you're pausing it and looking at it without the volume, right? You want to make sure that you have these structures down for when you're looking at them in lab. Okay, next we've got the radial fossa. So the radial fossa is going to be, if we follow the capitulum, right? If we, just like when we followed the trochlea up into the coronoid fossa, we can follow the capitulum up into its fossa. And the fossa just above the capitulum is going to be the radial fossa, because the radius kind of, when we flex, is going to move up into this fossa right here. Imagine the radius kind of just right into that fossa. That is going to be the radial fossa. All right. Now that we've got the ulna, called the ulna, this is the humerus. Now that we've got the humerus done, let's go ahead and hop into the radius. All right, so next we've got the radius. So for the radius, we've got to find, for the first thing that we need to find is our head. So the head of the radius is going to be the side that articulates with that capitulum that we talked about on our humerus, right? So if we've got the humerus right here with the capitulum, we see that the head of the radius, kind of this flat round structure, is going to articulate with that capitulum, right? See how that articulates? Flat round structure. All right, so we've got that head of the radius, that's going to be right here. Next, we've got the neck. The neck is going to be, let me find my pen. The neck is going to be just beneath the head of the radius, right? It's kind of that thin region just beneath the head of the radius. Kind of easy to see. All right, next we've got the radial tuberosity. The radial tuberosity is pretty intuitive to find. It's just this pretty big bump towards the top of the radius, right? It's this large bump on the side of the radius. That is your radial tuberosity, right? Next, we've got the ulnar notch. The ulnar notch is going to be down on the bottom of our radius, right? And it's going to be this little notch right here. That little notch is going to kind of, what we say is our ulna is going to articulate with this small spot, right? And just like a bookshelf where it's named after the things that go in it, we're going to name this notch after the bone that articulates into it, right? The ulna. The ulna articulates into the ulnar notch on the radial bone, the radius. All right. Last for the radius, we've got the styloid process. If we remember the styloid process that's up here in our neck, right? The styloid process just means a kind of a pointy structure. And I'll give you a chance. Where do you think that pointy stylus is on the end of this? Radius. If you guessed right there, you are dead correct. That is the right spot. That's the styloid process. It kind of points off the end of the radius. All right, that concludes section 1. Let's dive into section 2. All right, next we've got section 2 of lab 4. That's going to be the ulna, right? The ulna is a lot easier to kind of orient ourselves on because the top of it, or the proximal end, has this giant C shape, right? This C shape is going to be the top of our ulna, and the very top of it that forms the top of our hook is going to be the olecranon process, right? If we remember the olecranon fossa, right? The olecranon fossa of our humerus is going to just kind of work perfectly, just like Legos, right? That olecranon process fits right into the olecranon fossa of the humerus. So, olecranon process, very top of our ulna. Next, we've got the trochlear notch. The trochlear notch is going to be the inside of our C shape, right? That's the trochlear notch, and it, again, is going to articulate with that trochlea of our humerus, right, to help us bend our elbow. Next, we've got the coronoid process, which forms the bottom of our C. You can remember C for coronoid, forms the C, the bottom of the coronoid process right there. Next, we've got the radial notch. The radial notch is going to be this notch right here, right? If we remember how these bones are oriented with one another, it kind of helps us understand why they're named that. But we've got the radius right here and the ulna right here, and that radial head is going to insert right there, articulate right there on the ulna, right? Articulating right there. That way they can articulate with our elbow and help us flex, right? Okay. Now, the trickiest part about the ulna is that whereas the head of the radius is proximal, the head of the ulna is distal. So if we've got the head of the radius, which is going to be on this side, right? This upper end that inserts or articulates up right here, right? The head of the radius is up here. The head of the ulna is this end, this pointy end down here, right? Down here is the head of the ulna. And on the head of the ulna, we have the styloid process. That's that pointy structure. I'll let you guess where it's at. Pretty easy to see right there, right? That's that styloid process, just like a stylus from a 3DS, right? All right, let's go ahead and move into the hand. So the first structures that we're going to talk about on the hand are structures you're probably familiar with, and those are the metacarpals, right? There are 5 metacarpals on each of our hands. That's 1, 2, 3, 4, 5, right? That makes 10 total. Next, we've got the phalanges. The phalanges are going to be all of these bones that sit above the metacarpals, right? There are 14 of them total on each of our hands. That makes 28 of them total, both between the 2 hands. Now, it's important to remember there's also 3 phalanges per each finger, and there's only 2 on each thumb, and that's how we add up to that 14 per hand. All right, now, let's move into some structures that you may have not heard of before, and that's our carpals, right? Now, each of our carpal bones is going to have an individual name, and it's kind of hard to remember them all, but we've got a mnemonic that's going to hopefully help clear that up. So, the first one is the scaphoid. It sits down here and articulates with other structures in the wrist, right? Like the radius is going to articulate with that structure, the scaphoid. Next, we've got the lunate is going to sit right next to there. We've got the triquetrium, the pisiform, which is fused onto that triquetrium. And then next we've got the hamate, which is going to start right beneath the pinky. We've got the capitate, the trapezoid, and then the trapezium, which sits right below the thumb. Now, that mnemonic is going to be straight line to pinky. Here comes the thumb. Let's take a look at that up on the board. That's straight line to pinky. Here comes the thumb. See how it does that loop, right? It kind of takes a loop around all of those words. We're going to do the same thing, but with our carpal bones, right? So we've got straight line to pinky. Here comes the thumb. That's scaphoid, lunate, triquetrium, pisiform, hamate, capitate, trapezoid, and trapezium. Straight line to pinky. Here comes the thumb. All right. That's the hand. Hopefully that helps you remember that. Let's go ahead and move into the os coxae. All right, so this big structure, right, the os coxae, has 3 bones that are going to make up the majority of it. And importantly, this is an os coxae and this is an os coxae. They fuse together, right? And that's what forms our whole hip apparatus, our whole hip bone, so to speak, right? Now, if we move into just one of the os coxae, we're going to take a look at some important structures that we need to know for lab. So, the first one is that we need to know the 3 different bones. The ilium, which is going to be this area, the ischium, which is this area, and the pubis, which is this area right here. Now, those 3 bones are fused together, and that's why it's kind of hard to see where they're all distinguished at. But just know this area is the ilium, this is the ischium, and then this is the pubis. Now, let's dive into the ilium. The ilium is the top part of our os coxae, and it helps form the sacroiliac joint. If we remember the sacrum from our last lab, it's the sacroiliac joint, sacroilium, sacroiliac, right? Sacroiliac joint. Next, we've got the iliac crest, which forms the top border, right? The top border of our ilium. And it also helps form the ala, which if you look at this whole flared region of the bone, it kind of looks like a wing, right? Like a wing to a bird or a butterfly. And that's why we call it the ala. Ala just means flared wing. So we've got the top border, the iliac crest, the ala, which is this whole wing, right? And then the iliac fossa, which is going to be this flat depression that's found within the ala, right? This flat depression. All right, let's move into some of the posterior structures that we find on the ilium. The first one is the greater sciatic notch. It's the big notch that's formed partially by our sacrum and a couple other structures that we'll get into, but that is the greater sciatic notch. And we've also got the acetabulum. Now the acetabulum is a super important structure. It's where our femur, or the head of our femur, is going to insert in onto the os coxae. And importantly, it's formed by all three of these bones of the hip: the ilium, the ischium, and the pubis. They all come together right in the acetabulum. Never forget that word. All right, next we've got the anterior superior iliac crest, or spine. The anterior superior iliac spine, if we go anterior, superior, it's going to be this spine right here, right? Anterior superior iliac spine. If we go just beneath that, we've got the anterior inferior, just beneath, right? Superior, inferior. This is the anterior inferior iliac spine. Now if we move posterior, we'll find the posterior superior iliac spine. That's a mouthful, but that's found right back here on the sacrum, right? And next, we've got the posterior inferior iliac spine, which is going to help form the top of our greater sciatic notch. That's right here. We've got the superior posterior and the inferior posterior. All right. Now let's dive into the ischium. So the ischium is going to be this lower region of our os coxae, right? And it has kind of the area where we sit on when we're sitting in our chair. The first structure that we need to know is the lesser sciatic notch. So if we have the greater sciatic notch right here, the lesser is just beneath that. It's the lesser sciatic notch just right there, right? Next, we've got the ischial spine. The ischial spine is going to form the top of the lesser sciatic notch. So it forms the bottom of the greater sciatic notch and the top of the lesser sciatic notch. That's this right here, the ischial spine. Next, we've got the ischial ramus. If we think back to the mandibular ramus, it kind of means branch off of the main structure, and that's exactly what this is going to look like too, right? Just a branch or a bend in the structure, right? That is the ischial ramus. Now, ischial tuberosity, that's going to be this bony prominence on the back, and there are butt bones, right? That's what we sit on. They're huge. And so those are the ischial tuberosities. Don't forget those ones. Next, we've got the obturator foramen. The obturator foramen is this huge hole right here, this huge opening. And if we think back to one of our first labs, foramen means hole through a bone, right? Obturator foramen is just this massive hole. It allows for a bunch of nerves to go through, primarily the obturator nerve, which helps innervate part of our lower leg. But this is the obturator foramen. And again, we've got on the ischium, right? We've got part of the acetabulum, which is formed by the ischium, the ilium, and the pubis, right? So it also forms part of the acetabulum. All right, next we've got the pubis. The pubis is going to be this center bone, right? Or this center connecting region. And it has some very important structures that we've got to remember. The first one is this piece of fibrocartilage right here. This is the pubic symphysis, right? It's a piece of fibrocartilage that helps fuse the two os coxae together. Next, we've got the pubic crest. That's going to be this top border right here, right? The pubic crest is important because it helps kind of support the top of our os coxae's cavity. Next, we've got the subpubic angle. That's going to be this triangle shape that's formed kind of by the bottom of our two pubis, right? It's formed by the top of our pubic symphysis, that piece of fibrocartilage. So we've got the subpubic angle, and lastly, yep, you guessed it, we've got part of the acetabulum, which is formed by part of the pubis, right? So pubis region, ischial region, ilial region of the acetabulum, formed by all three bones. Just remember those structures and you'll be all set for lab. All right, let's dive into the femur. So for section 4 of lab 4, we've got the femur. The femur is one of the largest bones in our body. It is the largest and strongest bone of our body, right? And it's massive. Thing is huge. Now, the first thing that we need to remember is that the femur has a head, right? The head of the femur. And what does that insert into, right? What structure on the os coxae? The acetabulum. Nice job. Hopefully you got that one, right? We've got the head right here, the neck, which sits just below the head. And then we've got the greater trochanter, which is going to be this large bony prominence, and the lesser trochanter, which is just down here, right? So those are kind of our first structures of the femur that we need to know. If we flip the femur around, look at the posterior view, now we've got the linea aspera. That's this line that kind of goes down the back of the femur, and it helps with different tendons kind of inserting in on there from different muscles. Next, we've got the lateral condyle, right? So if we flip back over onto our anterior view, we see that this is the head of the femur, so it tells us that this way is medial, right? If we look down here, we can see that the lateral condyle is going to be this one, since the head points that way, and the medial condyle is this right here. If that's the case, then the lateral epicondyle is going to be just up here, and the medial epicondyle is going to be just right here, right? And the last structure of our femur that we need to know is this space kind of in between the two condyles, right? And it's called the intercondylar notch or fossa. Here's the two condyles, and here's the intercondylar notch. And it also helps us, it kind of helps form the knee joint that we have, and with all of the different collateral ligaments that there are, with the ACL, the PCL, and then the two side ligaments as well. All right, next let's dive into some of the other structures of the leg, like the patella and the tibia. So before we talk about the tibia, just remember that even though this model doesn't have one, we still have our patella, right? Our patella is going to be our knee bone, right? That bump on the top of our knee that we're all very familiar with. And if we move it just right, it kind of shifts and moves the top of our other bones. And that's because it's a sesamoid bone. It's actually fused to two other tendons. And that's what helps it stay, that's what kind of helps it float above the whole knee apparatus. But let's go ahead and talk about the tibia. So here's the tibia, and the tibia would be sitting just kind of right here with the patella sitting over top of it, and then we've got some different ligaments inside of here, right? And let's talk about the different structures that we need to know for the tibia. The first one is the medial condyle. Now it's kind of hard to know which way is medial and lateral when you get on to some of these bones, but if you remember for the tibia, this point down here is called the medial malleolus, and it's in line with the top. This is the medial condyle. So we've got the medial condyle on top, the lateral condyle right next to it, and the intercondylar eminence. That's where the ACL and the PCL are going to run, right? We've also got our medial and our lateral collateral ligaments as well. And so they'll run along here, along the sides, right? Medial and lateral collateral, and those will help hold all of our knee together. But we've got the medial condyle, the lateral condyle, the intercondylar eminence, and let's keep on going. The next one that we've got is this bony structure. That's the ischial tuberosity, I almost said ischial tuberosity. This is the tibial tuberosity. We're not on the os coxae, we're on the tibia. Tibial tuberosity, right? That helps form kind of our knee bone. That's where we knee things with. It's also where our patella, or where our patellar tendon is going to attach, right? So that patella tendon attaches right there on that tibial tuberosity. This is the anterior border because it's the anterior, right, front side of this whole bone, so it's the anterior border. Down on the bottom, we've got the medial malleolus, right? We talked about that at the beginning. That's how we keep in line and find our medial condyle as well. And those are all of the structures that we need to know for the tibia. Let's look at the fibula now. So, the fibula is interesting and it's kind of hard to orient yourself, but you only need to know two structures on it, right? You need to know the head, and you need to know the lateral malleolus. If we have the fibula, if we got the tibia right here, we got the fibula right here, we see that this is going to be the head, articulates with the top, and that bottom is going to be the lateral malleolus, articulates with the bottom, right? Medial malleolus on that side, lateral malleolus on that side. All right, time for the last couple structures for this section. We've got one of the hardest ones. It's the foot, right? The foot is one of my favorite bone structures on the body just because it's so much fun to learn. Now, let's dive into it. The first bone is the calcaneus. That's our big old heel bone, right? Big calcaneus right there. Calcaneus, talus, navicular, medial cuneiform, because there's our big toe, right? It points medially that way. So we've got the medial cuneiform, the intermediate cuneiform, the lateral cuneiform, and then the cuboid right here. Now, Those are kind of hard to remember, but we've got a mnemonic that should hopefully help clear it up. Let's take a look up here. That's call Tony now. Mom is licking cocaine, right? If you can remember that, take a look here. We've got calcaneus is call, Tony's talus, navicular is now, medial is going to be mom, intermediate is lateral, licking, cuboid for cocaine. We've got callus, talus, navicular, medial, intermediate, lateral, and cuboid. Call Tony now. Mom is licking cocaine. Awesome. And that is all of Lab 4. Good luck on your quiz this week, and I'll see you for the next one.